May I know your name and your age, please?
My name is Shakaman. I'm 50 years.
May I know what is your current address?
Lenin Street, yeah, 550.
Alright, may I know what's wrong with you today, Mr. Chia?
Currently, I'm facing pain all over my abdomen and I have difficulty breathing.
Okay, then may I know, does the pain radiate to other parts of your body?
No, it doesn't.
Okay. Did you vomit recently?
Yes, 3 times today.
Okay then. Do you feel tired or lethargic?
Very for the past few days.
Do you have fever?
Yes.
Okay then. How is your appetite and your bowel movements?
It hasn't been good. I haven't had any bowel movements for the past 3 days.
Okay. When did all these symptoms started appearing?
I think it was about 3 days ago.
Okay. Do you have any trauma to your abdomen recently?
No.
Any accidents?
No, I have not.
Okay. Do you have gastric ulcer in the past?
Yes, 5 years ago.
Okay. Did you get it treated in any hospital or clinics?
No, passed myself.
Okay. Do you have any allergies? And if you do, may I know what it is?
It was cocaine, I think.
Okay. Do you receive any blood transfusion recently?
No, I have not.
Good. Do you smoke?
No.
No. Okay. Do you drink alcohol or took any drugs before?
No.
No. Okay.
Don't do that.
Does your family have any inherited diseases?
No.
What about diabetes mellitus? Do you have it?
So, no.
No. Do you have any operations or surgery recently?
No, I have not.
Did you suffer from TB
No.
in the past? No.
I have no.
Do you have a stroke or myocardial infarction before?
No.
May I know, do you take any medication?
Yes, for my fever, I'm going to be taking diclofenac, 75 milligrams.
For how long?
For the past, since my fever started, which is 2 days ago.
Okay. Lastly, do you have any childhood diseases? Okay, no.
This is the conclusion based upon the subjective examination.
For your condition, you seem to be in a middle grade condition. For your Glasgow coma scale, I will give you 13 points because your verbal response is quite slow and you look quite confused. For your age, you look quite old for your age. Okay, sir, now I'm going to check your skin. Can you open your shirt for me, please? Okay, by the looks of it, your skin has a greenish yellowish tint. Now can I check your mucous membrane, please? Can you open your mouth? Your mucous membrane seems to be a bit dry. Right, thank you, sir. Now I would like to check your body temperature. So I will put the thermometer in your mouth and check the temperature. Can you do that for me? Just close your mouth and let it sit for 1 minute. Your temperature is 38.3 degrees Celsius. Alright, sir. Thank you.
After general inspection of the patient, this is the information we have obtained.
Alright, sir. Now I'm going to do objective examination on different systems of your body. So let's go to the examination table. Is that okay with you?
Yes.
Okay, alright, let's do it. Alright, sir. Now I'm going to do an objective examination of your respiratory system. Firstly, I would like to look at the form of your chest. Everything looks good. Now I would like to measure your respiratory rate. Can you breathe in normally for me in 1 minute? Okay, I will start the countdown now. Just breathe in. You can start now. Cut. discuss your chest movements. I'm going to do palpation. Is it okay with you? Okay, let's start. Can you inhale deeply for me and exhale, please? Inhale, please. And exhale. Once more. Inhale, please. Once more. Alright, so I'm going to assess your vocal parameters. I'm going to place my hand on your chest and your back, and I need you to say 99 repeatedly. Is that okay?
Okay.
Okay. Alright, let's start.
99, 99, 99, 99, 99, 99, 99.
Now I'm going to percuss your chest. Is that okay? Alright, let's start. Now I'm going to listen to your lung sounds. Is that okay? Okay. Let's start. Can you breathe in deep for me?
Upon objective examination of the respiratory system, the patient has shallow, noisy retractions and dyspnea during breathing. There was no pain during palpation. Dullness in lower parts of the lungs were detected during percussion, and wheezing and crackles were discovered during auscultation.
Okay, so now I'm going to do objective examination of your cardiovascular system. Firstly, I would like to start with you to measure your pulse rate. Alright? Okay. Can you give me your left arm? And I'm going to measure your pulse rate for 1 minute. Alright, so now I'm going to measure your blood pressure, okay? Alright, so now I'm going to palpate your heart. Is it okay?
Yes.
Okay, let me start. Alright, so now I'm going to percuss your heart borders. Is that okay?
Yes.
Alright, let me start. Alright, so now I'm going to listen to your heart sounds. Is that okay?
Yes.
Okay, let's start.
Upon objective examination of the cardiovascular system, the patient has hypotension and tachycardia. There was a weak apical impulse during palpation. Percussion sounds were normal, but there were vague sounds during auscultation of the heart. After objective examination of the genitourinary system, we found that everything was normal on inspection, palpation, percussion, and auscultation.
Okay, now Mr. Chair, I'm going to start an objective examination of your gastrointestinal tract. Let's start with inspection. Can you put out your tongue for me?
Yes.
Yeah, yes. Alright, thank you. Can you put out your hands for me? Okay, can you show your palms? Alright, thank you. Now can you put your fingers like this? Together? Yes. Alright, thank you. Let me check your skin. Everything looks good. Alright, now sir, I'm going to palpate your abdomen and I would like you to tell me if you feel any pain here after palpating. Is that okay? Alright. Do you feel any pain here? What about here? Here?
Yes.
What about here?
Here.
Do you feel pain here?
Yes.
Here? Here? Right, sir, now I'm going to percuss your abdomen. Is that okay? Alright, let's start.
A digital rectal examination was also performed on the patient, and the results were normal. Upon objective examination of the gastrointestinal system, we found that the patient has a dry tongue, distended abdomen, and thoracic breathing. During palpation, pain was felt by the patient on all quadrants. The borders of the liver were not found during percussion.
Alright, so now I'm going to tell you my diagnosis. So my primary diagnosis is that you have severe multiple organ dysfunction syndrome, which is caused by your gastric ulcer perforation, and as a result, it causes peritonitis. This infection leads to septicemia in your blood, which spreads to other systems in your body. You are also suffering from hypovolemia. Yes, that's why you feel dizziness, confused. Your skin is dry, your mucous membrane is dry, and also causes your hypotension. There are dullness sounds, wheezing, and crackles in your lungs, which indicates that you have respiratory system dysfunction. The pain all over your abdomen that you felt just now is because there's peritonitis, which causes gastrointestinal dysfunction. On inspection just now, the greenish, yellowish color of your skin suggests that you may also have hepatic dysfunction. Is that clear for you? Okay, that's good. Alright, sir. To make a complete diagnosis, we have to run a few lab tests on you to make sure that the primary diagnosis is correct. Is that okay with you? Okay.
Now we move on to the further investigation, and for the first part, we need to take a look for the blood composition, and we expect the patient to have a high AST, which is aspartate aminotransferase, alkaline phosphatase, high creatinine, high urea, high bilirubin, reduced amount of protein, and dysproteinemia. And the results are the same, which the patient is having the same expectation. And then for the CBC, for the complete blood count, we expect the patient to have a low white blood cells, left shift, high ESR, which is the erythrocyte sedimentation rate, HT is high, and the low red blood cells, and the results are also the same as we expect. And then for the plain X-ray, we need to find some evidence of the respiratory problem, which leads the results the patient is having phonoperitoneum, in which the presence of air or gas in the abdominal peritoneal cavity. And for the ultrasound and the computer topography of the abdomen, we expect of anything suspicious for this patient, but leads to the result of the fluid in the abdominal cavity. So in conclusion, we separate into a few parts. And for the first part is the respiratory dysfunction. So we need to find out if the patient has respiratory dysfunction, and the answer is yes. Because of the damage of lung tissue due to the circulation of pro-inflammatory mediators PIM and bacterial toxins in the blood, in which leads to the pulmonary edema. Thus, exudate is secreted into the surrounding tissue due to the increased permeability of vascular wall. And then secondly is the cardiac dysfunction. So the patient is having cardiac dysfunction due to tachycardia, hypotension as a result of hypovolemia. Thirdly is the hepatic dysfunction. Yes, the patient is having acute hepatic dysfunction. We observe a greenish yellowish tint of the skin, and from the lab test, the bilirubin level is increased. And for the gastrointestinal dysfunction, yes, the patient is having GIT dysfunction. So basically, peritonitis has an infection of GIT, in which results in damage of tissues in the GIT and the rise of pro-inflammatory mediators PIM from the dead tissues. So the next part is the renal dysfunction. The patient is having signs of renal dysfunction from the urine output, which are decreasing, and we need to insert Foley catheter to measure the urine output. Thus, we conduct the lab test for the creatinine level, which is increased, and the serum urine level is also increased. And is it perirenal? Yes, due to the hypovolemia and hypotension. And for the next part is the CNS dysfunction. Yes, the patient is having cerebral nervous system dysfunction, and it was damaged by the hypoxia. And then for the hematology dysfunction, so basically we need to check for a clinical picture of uncontrolled bleeding, and for the example is the DIC, which is a disseminated intravascular coagulation. First, we need to carry out the laboratory test for the red blood cell count, and then blood congestion, in which leads up to anemia, and also for the white blood cell, and then for the blood chemistry test, AST and ALT, which are also increased, dysproteinemia, and a reduced amount of proteins, and also changes in the electrolytes, elevation of creatinine, and also the plasma urea and bilirubin. And now for the final conclusion, yes, the patient is having MODS, multiple organ dysfunction syndrome. So peritonitis has a 7 systems which are dysfunctioning. So this MODS occur in this patient as a result of infection in the peritoneum, abdominal cavity, and for the management of MODS also includes from the antibiotics, fourth generation of cephalosporins, vancomycin, and aminoglycosides. This will replenish fluids by infusion therapy, and also respiratory support by oxygen supplementation for the nasal cannula.